what we're also able to do is get to people usually very, very, very quickly compared to, it can take quite a while to get the order for home health or to get the order for outpatient. Gotcha. And then how do you schedule to get into outpatient and you're waiting, several weeks for someone to even call, or you're having to call and follow up. Getting through to somebody in healthcare has become a big problem. In a hospital system, it's become even worse. We see doctors leaving hospital systems now and going out on their own simply because they get tired of patients not being able to get through to their office because they have to get channeled through the big hospital system phone tree in order to get through, and they can't get through. We've gotten too big. You said this early on. It's gotten too big. And again, and that's fine. If you need heart surgery, a big hospital system's a great place to be. If you need intensive inpatient rehab and you need a multiple specialized rehab team, then a big hospital system's a place to do it. But if you want to basically remain in your house and have the right medical team, the right rehab team, the correct healthcare management, there's a whole bunch of services now and in new, fresh models that allow you to be active and independent in your home. I get a common question I'll often get is, which skilled nursing facility should I send to my parent to, or what skilled nursing facility would you recommend, or what assisted living facility would you recommend? And of course, I've worked in a lot of different facilities, and of course, my response is none of them. And I think that's been every person's response who does get that question. I haven't yet heard of someone give a specific place to go. And the reason for that is because it's all under the same system. You can put as many flowers and, happy hours and all sorts of things. And don't get me wrong, there's some nice places and some places better than others. And there's some new models now, and there's some innovative ways to approach, the way that older people, live in certain situations. And that's good as well. But when I get the question of what assisted living facility or nursing home or whatever should I send my parent to, to me, the question is, okay, can they remain active and independent in their home? Is it realistic? It's not always. And then you can really dig down and figure out the right fit as far as a facility. But especially with the pandemic, a lot of people saw what happened with facilities during the pandemic, where you have older people being completely locked in, you have families being locked out, you have people that are on hospice, on their deathbed literally, and their loved ones can't get to them.
It's heartbreaking.
That's the type of power that government and healthcare, and when things get this big and institutionalized, that type of power becomes very personal when you can't visit somebody on their deathbed. And that's the world we live in, because we saw that all the time during the pandemic. During the pandemic, we were able to get to people's homes, but the older generation, they weren't streaming exercise classes. If they weren't getting out and having coffee with their friends, if they weren't getting out to the symphony, if they weren't getting out to whatever activity that they genuinely enjoyed going to, their regular activities, again, back to if a generation that didn't grow up with formal exercise, physical activity was not a formalized thing as well. Or going and walking with friends. If you now could no longer walk with your friends because you had to stand 6 feet apart at least, well, okay, why bother? What's going to happen to your physical abilities? What's the increased likelihood of falling, which skyrocketed? What's going to happen to your ability to think? What's going to happen to your cognition? We saw that as well during the pandemic.
It's all connected. It's going to deteriorate.
It's going to deteriorate. So how do we get to people? Again, it's, whatever happens, but how do we create models and services that can get to people in different ways? And how do we give them different options so that people can make different options? And we don't have to just accept the only route is a facility.